failed. But that's actually not true. New research from the Burnet Institute, exclusive to 7:30, has shown just how bad the numbers in Victoria would have been without the Stage 3 lockdown. Before Melbourne introduced Stage 3 lockdowns, the reproduction number was 1.75. That means for every 10 infected people, they were passing the virus on to more than 17 others. The Level 3 restrictions brought that infection rate down to just over 11 people, which means that about 20,000 infections were avoided during July.
We can assume we would have had 3 to 4 times the number of deaths, 3 to 4 times the number of serious illnesses. So a very major impact of Stage 3 lockdown.
But according to Professor Brendan Crabb from the Burnet Institute, it would be a mistake to assume that the new measures put in place yesterday aren't necessary. There are still too many people being infected.
Well, we're still left with a community spread that is growing very slightly, just above an R0 of 1. Perhaps masks kicking in is going to take that closer to 1. We don't know the answer to that yet. So we don't have a epidemic in decline. We have the rate decreasing, but not an epidemic yet going down to zero, to elimination, which is where we want to get to in the community.
Given reports of poor compliance with isolation and distancing in Victoria and signs of community fatigue, Professor Crabb and his colleagues argue that getting communities to suggest what messaging will work for them is the answer, not more fines.
Punitive approaches announced at a press conference simply don't affect too many people. You need a different approach. You need a community-centric approach.
And they say contact tracing needs to be greatly improved.
The community would love not to be taking lockdown measures, but still dealing with COVID. And of course, that requires that you do know pretty much where every case comes from, that your systems are so strong and so spread out in the community that they detect all those cases. We don't have that system quite yet. And so we have to go to these, really draconian, harsh measures that I support, but make me feel slightly sick in the stomach at the same time.
Working out where people caught the virus and who they passed it on to is the foundation of Australia's response. So how has this not stopped the number of Victoria's cases growing? And why are we only now discovering that there are hundreds of people who've been infected by unknown sources?
In Victoria, we probably had a reintroduction of the virus through a number of different guards who'd become infected through the work connections. So we had it taking off in multiple parts of the community before we were aware that we really had this second wave of community transmission happening.
With each infected person having up to 10 contacts, there must be a limit to how many cases contact tracers can manage at one time. Has Victoria hit that limit?
We know we've got over 2,000 people working on this, both people in Victoria and also interstate healthcare workers. They've suggested the capacity allows them to deal with up to 800 new cases a day, assuming they all need this sort of intensive follow-up.
The state has also been compared unfavourably to New South Wales, where contact tracers have been able to quickly pin down the source of almost all COVID infections.
In New South Wales, they had a real advantage over Victoria. They could not only do the contact tracing with fewer cases and be really aggressive about that, but they could put the call out for locations where they felt that was a source where each case had become infected. So the Crossroads initially, but then the Thai restaurant and so on. And that's a powerful tool that Victoria never had.
So what is the payoff for Melburnians in return for the pain of this progressive lockdown?
The payoff is the elimination of the virus from the community. It will mean a radical difference to Victoria and a radical difference to New South Wales.
Dr Nick Coatsworth is the Federal Deputy Chief Medical Officer and he joined me earlier from Canberra. Dr Coatsworth, when you hear the daily briefing in New South Wales, they are so tight in rapidly tying cases to known clusters. We've heard various theories about Victoria and their problems doing that. What's your view as to what's gone wrong in Victoria with contact tracing?
Well, I think there have been a couple of remarkable and important differences between the New South Wales outbreak and what's going on in Victoria. Once the Victorian outbreak was embedded within the community, very much within household groups where there were larger household gatherings. It quickly got to the stage where there were many multiple and geographically dispersed clusters, if you will, of COVID-19, really ramping up the contact tracing demands very, very quickly on the Victorian system. If you contrast that to New South Wales, which after the border closures was really dealing with point source outbreaks, the Crossroads Hotel, then able to trace those through to the Thai Rock in Wetherill Park and various other places. It is, from a New South Wales perspective, not a more straightforward exercise. It's still equally as difficult, but it's able to be done and keeping the numbers between about 15 to 20 per day. So that gives you an impression of the numbers that you can keep the outbreak under control at, and that's what New South Wales is doing at the moment.
Obviously, a lot of hope is being put in a vaccine, but what happens if there's no vaccine? Because presumably you can't keep putting cities into stage 4 lockdowns month after month after month.
We do have the entire world scientific community looking at this. We got a head start with the MERS and the SARS coronaviruses, so there is good reason to have hope for a vaccine. But at the same time, we do have to be able to prepare for an environment where that vaccine is not present, may not be as effective as we would like it to be, and that may last for 6, 12 or 18 months. So that is why that our focus in Victoria at the moment has to be getting those numbers down under control, to the point where the public health unit knows where COVID is, who's got it, and why it's there and what we're going to do about it. And essentially what that means is you identify all your cases of community transmission and keep those numbers low. And if you see what's going on in New South Wales at the moment, we've got a number which, while not entirely comforting, is under control from the perspective of not leading to a second wave in New South Wales.
We've heard from cancer experts that there's been a 30% reduction in the reporting of cancers in Victoria, presumably because people aren't going out to get checkups. Mental health experts also tell us that the rate of suicide will go up. How do public health authorities weigh the easily measurable deaths from coronavirus against how many other deaths lockdown might inadvertently cause?
The first thing we have to say is we're acutely aware of all the non-COVID related issues that controlling COVID has, and you've mentioned a few of those. So the challenge for public health officials, and then our advice to policymakers, is what can we do to get people tested for cancers, get people's diabetes or high blood pressure under control. The first step has always been widespread use of telehealth, which was one of the major policy steps, and then the general practitioner takes control in directing people to get tested at various places. But what we also need to remember is that all the radiology firms, the pathology collection centres, even in Victoria, still have COVID-safe plans. They still keep you separated from other people. So it is absolutely critical that, even though I understand the anxiety that it would cause going to a healthcare facility in Victoria at this point in time, people must take care of their health over and above COVID and get those things checked out. If you're concerned in any way about your health, contact your GP via telehealth and they will direct you in the appropriate fashion.
Dr Coatsworth, thanks once again.
Thank you, Lee.
We want to keep hearing your stories during this pandemic. If you have an experience you're willing to share, our email is 7.30@abc.net.au. The economic shockwaves from the Victorian coronavirus outbreak are set to intensify with the closure of all non-essential manufacturing and industry in the state today, as I mentioned earlier. Victoria's situation means the federal government's 2-week-old economic forecasts have already been shredded. Late this afternoon, the Prime Minister, Scott Morrison, announced disaster payments to Victorian workers without sick leave. Chief Political Correspondent Laura Tingle reports.
It takes quite a lot to render the official national economic forecasts redundant in a week.
The shock is far from over. This is obvious to Australians living in Victoria. Growth will be lower, unemployment will be higher.
Treasury Secretary Stephen Kennedy last week conceded that the forecasts the government had released just 1 week earlier had already been rendered redundant by the escalating health crisis in Melbourne. And that was before the announcements yesterday that Melbourne would enter an unprecedented lockdown and today the outlining of businesses that would also face shutdowns.
Moving to stage 4 restrictions and extending the lockdown means the cost to GDP has tripled from $6 billion to over $20 billion.
Andrew Charlton has been compiling data on spending patterns in Australia. Total spending in Victoria was already 14% below the level of other states last week, and spending in cafes right across the state, not just in Melbourne, is almost a third lower than in New South Wales.
There is firstly a real economy impact as the lockdown ensures the border stays closed, disrupts logistics and supply chains and reduces the flow of goods and tourists across the border. But secondly, there's an important symbolic effect which can knock confidence.
The Everleigh Hotel in Melbourne will persist with delivering bottled cocktails to a city under curfew. But there seems to have been a material change in people's attitudes to the virus that goes beyond broad measures of confidence.
I think there were definitely two different types of lockdown that we've seen so far. I think the first one was definitely a lot more of a novelty where everybody was really getting behind seeing their favourite venues deliver their goods to their homes. And I think the second one has probably brought around a little more fear as to how many times can you shut down and how much support can you give before you really have to take care of your own bank accounts.
And this afternoon, more to absorb, with a shockingly long list of businesses and industry forced to close, everything from car dealerships to sex shops. But particularly significantly, the majority of the building industry, which has to date kept powering on through the pandemic. And there is more. In the rest of the country, consumers have been on a spending binge in the past couple of weeks, fuelled in part by a second $750 coronavirus payment to 3.5 million people, and by the widespread drawdown of superannuation savings.
We might end up in a double whammy situation where we are coming off the sugar hit of those stimulus and super payments and also hitting a trough of confidence as the Melbourne lockdown bites.
Politics is being forced to change by this new stage of the crisis. Blame games and attacks on state premiers for border restrictions are now more difficult.
I tell you what, we will deal with it. Victorians I know are up to it.
After weeks of resisting, the government this afternoon announced a $1,500 pandemic disaster payment for Victorians forced to self-isolate who do not have sick leave and have been directed to stay at home by a public health official. Aged care workers employed as low-paid casuals are believed to have helped spread the disease because they could not afford to stay away from work and were working shifts in multiple aged care facilities. It's given a new urgency and focus to the debate about the casualisation of the workforce.
Sally McManus is the Secretary of the Australian Council of Trade Unions. She spoke to me from Melbourne. Sally McManus, the Prime Minister's announced a $1,500 pandemic leave payment this afternoon for Victorians. Does it meet what the ACTU and the Business Council were jointly calling for earlier today?
Well, look, it's a step forward, but it doesn't meet what we were calling for, and the reason why is for two reasons. First of all, we've got to eliminate any penalty whatsoever for people to isolate. So any financial penalty will be a disincentive for people to isolate. So $1,500 a fortnight is about the minimum wage. The average wage is more than double that. So for some workers, you're basically saying to them, if you've got to isolate, that you're going to have a significant pay cut. We've just got to take away that disincentive. It's just a hole in our defences. The second issue is about delivery. You just got to make it as simple and easy as possible, just like sick leave. You get sick leave, you get paid your normal leave, your employer pays it, the government reimburses it. That's what the Business Council and the ACTU were calling for. Whilst it's good, you know, people aren't going to get nothing and there's going to be an improvement, it's still not what's needed to make sure we're doing absolutely everything we can to keep the virus under control.
What do you think is going to be the impact of the Victorian government's decision today to shut down almost all manufacturing and industry in the state?
Well, we know that that's going to lead to a lot of people being stood down. I think it's about 250,000 people in that situation. So that's going to have a big impact on people. Those people will end up being on JobKeeper. Unfortunately, if you're in the early childhood sector, because for some reason the government's excluded early childhood centres from JobKeeper, they will get nothing, which is something that really